A very good morning and welcome to our session on the topic Embryo Transfer. We are glad to have Dr. Ramyasree, consultant at Apollo Fertility, Annanagar, with us today to help us understand the topic, also to give you insights on the topic. So, if you have any doubts, any queries related to the topic, post that on the comment section and our doctor will take all your questions by the last of the session. Also, to get whole information about the topic, just stay tuned till the last. Also, your questions can get answered later, so don't forget to drop all your queries on the comment section. Now, doctor, you have the stage.
Good afternoon, everyone. This is Dr. Ramyasree Reddy. I'm a consultant fertility specialist at Apollo Fertility, Annanagar, Chennai. Welcome to this Facebook live session. Today, we'll be talking about embryo transfer. Like we all know, with the rising infertility concerns, we have discussed previously that IVF is one of the modalities of treatment. IVF, also called as in vitro fertilization. In this, what happens is in every month, one egg continues to grow and becomes dominant and gets ovulated in a normal cycle. When somebody is undergoing IVF or in vitro fertilization, the idea is there is ovarian stimulation in the form of hormonal injections given, and these injections help multiple eggs grow in the ovary. The reason why we are ensuring that more eggs develop is when we have more eggs at hand, the chance of us to have multiple embryos and multiple attempts at embryo transfer is possible. So, in an IVF cycle, if you would like to discuss it in multiple steps, the first step would be the stimulation protocol for ovarian stimulation. And once the eggs reach a particular size, which is something around 17 to 19 millimeters, a final injection called trigger is given, and this injection helps the final maturation of the oocytes, that is, the eggs, happen. Once that is done, 34 to 36 hours after the trigger shot, we do something called oocyte retrieval. This is nothing but a transvaginal procedure done under anesthesia, wherein, with the help of an ultrasound probe, for example, a probe ultrasound transvaginal probe looks like this. A needle is mounted on top of the probe, and this probe is introduced into the woman's vagina. From the vagina, we approach the ovaries, and the oocytes are picked up. Rather, the follicular fluid is collected with the help of a suction mechanism, and this fluid is examined under the microscope by an embryologist to look for the eggs present within the follicles. So this is the process of oocyte retrieval. And now what happens to the oocytes which are retrieved in the lab? These eggs or oocytes are examined under the microscope, and on the same day, the husband is asked to give his semen sample. And based on whether we are doing an IVF or ICSI, we have more often moved over to ICSI these days, wherein the best quality motile sperms are selected by the embryologist under the microscope from the semen sample. And if we have, let us say, 10 mature eggs which are retrieved from the patient on the day of oocyte retrieval, these 10 eggs are injected by 10 good quality motile sperms. So if you were to discuss, let us say this is an egg and this is a sperm, there is direct injection of the sperm into the oocyte happening. And then we continue to monitor them in the lab. So instead of whatever happens in the body in a natural process in the test in the fallopian tube, this is replicated in the embryology lab. So these eggs are continued to be observed day 1, day 2, day 3, day 4, day 5 for their process of growth. When we look at them following the procedure of ICSI, the next day, we are trying to look for how many eggs have fertilized. This is what we call number of fertilized oocytes. Then they are continued to be monitored. For example, two significant steps at the development monitoring are a day 3 embryo and a day 5 embryo. A day 3 embryo is called cleavage stage embryo. A day 5 is called a blastocyst. A cleavage stage embryo roughly has around 6 to 8 cells, and this is one significant form in the development of the embryo. We look for how many day 3 embryos we have, and based on the number and quality and what was the discussion that was done with the patient, we choose whether to go ahead and wait till day 5, which is done more often. And in very rare scenarios when the numbers are very less, or for any reason we have discussed with the patient that we have very few number and patient has told that we will freeze the embryos at day 3 stage. Except for these cases, in all the stages we continue to observe them till day 5. So day 5, like we have discussed before, is in blastocyst embryo. This has a well-defined outer layer called the trophectoderm and an inner layer called the inner cell mass. The trophectoderm forms the placenta of the pregnancy, and the embryo is made by the inner cell mass. This is how a day 5 embryo looks. When now coming to the topic of embryo transfer proper, these embryos, when they are gently placed back into the uterus, this procedure is called an embryo transfer. So when do we do embryo transfer? Can we do it just like that? These are one of the frequent questions that we face. So there are two kinds based upon the timing at which the embryo transfer is done. One is a fresh embryo transfer, the other one's a frozen embryo transfer. When we say fresh embryo transfer, the name itself means what it says. So the embryos are fresh. That means, like we have now discussed, let us say today is the day of oocyte pickup. We are continuing to monitor these embryos until day 3 or day 5 state. Let us say they have reached the stage of day 5 and the embryos are looking good. At the same time, we monitor for the uterine lining of the patient. If the uterine lining is good, the blood flows are good, and the hormonal levels are all normal, we do something called fresh embryo transfer, wherein if you take a look at this picture, this is the female reproductive system. This is the uterus, this is the uterine cavity, fallopian tubes, and these are the ovaries. So once we have embryos ready at hand and we have planned to go for embryo transfer, this procedure is introduction of embryos with a small catheter into the uterine cavity, and these embryos are gently placed in this cavity. So if we are doing this in the same cycle as oocyte retrieval, that means today we have done retrieval, the fourth day, third day post retrieval, or fifth day post retrieval. If we are doing the embryo transfer back, this is a fresh embryo transfer. So what is frozen in a frozen embryo transfer? For example, for any reason, either the lining is not good or the woman has high supraphysiological levels of hormones, wherein we know that if you do the embryo transfer now, the chances of success are very less. In these times, what we inform and communicate with the patient is that the embryos need to be cryopreserved. That means the embryos will be frozen with the help of liquid nitrogen. And at a later time, we will prepare the endometrial lining. And once everything is ready, these embryos will undergo the embryo transfer. That is the same process of gently depositing them back into the uterine cavity. This will be done at a later date when every other procedure has been optimized for the development of these embryos and to promote better implantation of these embryos. So that is a frozen embryo transfer. So what are the things we look at when we are doing an embryo transfer? Like we all understand, first important thing is the embryo quality. So when we look at, for example, a seed that is being put in the soil to grow into a plant, we can equate that to the scenario of a embryo transfer. Seed is nothing but the embryo, soil is nothing but the uterine lining or the endometrium, and the process of getting a plant out of it, that germination process, can be equated to implantation of the embryo and thereby getting a successful pregnancy. So for every seed that is deposited in the soil, we do not get a plant, right? So what decides whether a plant is going to come out of a seed or not? First thing is looking at the seed quality. Sometimes the seed quality is not good, and let us say a very tiny kind, a very early stage seeds are given in the nurseries, shops, etc. And those things are not capable of producing life. So first thing to look at is the embryo quality. Second thing, the soil in which you are putting it, if it does not have adequate moisture, adequate water supply, or if it is not nutritious enough, the plant cannot be germinated out of the soil, right? In the same way, in the uterus, the endometrial lining plays the same role. It needs to not have any abnormal growths. Its vascular supply, that is, the blood supply, should be good, and it should be able to provide the nutrition that is required for the growth of an implanting embryo. After this, what happens is the interface, that is the soil seed interface. Same thing applies to the embryo also. Let us say this is an implanting embryo. It comes in contact with the uterine lining. Then there is something called chemical exchange between the embryo and the uterine lining. This gives in a few signals, and the endometrium gives in a few signals. And with this crosstalk decides which of these embryos are going to be implanted and are going to continue as healthy pregnancies. So these are the various factors that need to be looked into and need to be optimized to help in having better chances of a successful pregnancy. So, how is this procedure done exactly? For example, like we have discussed, in a fresh embryo transfer, we do it on the same day. Once the day 5 embryos are ready, if everything else looks good, the embryo transfer will be done that day. Now, in a frozen embryo transfer, like everyone asks, when is this done? So once the oocyte retrieval is done, for whatever reasons, once we have decided the embryo transfer plan is is a frozen one, or for example, when some cases we require something called the pre-implantation genetic testing. Pre-implantation genetic testing is when we test the embryo for understanding the genetic material. Let us say in advanced maternal age, or if somebody has had previous multiple failures. In all these cases, to understand whether the seed is healthy, we do the pre-implantation genetic testing. Because the turnaround time for this test is around 10 to 15 days, we cannot go ahead with the fresh transfer in these cycles. So, what do we do once the retrieval is done? We ask the patient to wait for her next period to come. Once her period comes, which usually will take around the time of 10 to 12 days, we would have had the report of the pre-implantation genetic testing. So the patient informs us once a period comes, and on her second day or first day of a period, there will be a baseline scan to understand how her uterine lining looks like, how the ovaries are, etc. And there will be a few blood tests that are advised. Everything once looks good, we start the preparation of endometrial lining to do something called a frozen embryo transfer. So, in this frozen embryo transfer, depending upon which protocol we are following, there are three different types. One is a natural cycle frozen embryo transfer, another is modified natural cycle, third one is the HRT cycle or hormone replacement cycle. So, we have discussed in the initial part of this video that once there is an egg in the ovary, which continues to grow from period day 2 to day 15, and around day 15, it attains its maximum size and then gets ovulated. So, what happens is this growing egg is hormonally active. It produces hormones called estrogen. And this estrogen continues to promote growth of both the egg and the endometrial lining. If we utilize this egg to produce the hormones in the embryo transfer cycle, we call this a natural cycle. Unlike this, if we are not allowing the ovarian function or the growth of the ovaries from inside for whatever reasons, for example, let us say the lady has a premature ovarian insufficiency, or if she has undergone a donor cycle, in these cases, we do something called the HRT FET, wherein the hormones produced by the egg are given from outside into the woman exogenously. So instead of the egg producing them, the ovaries will remain quiet in that cycle, and these hormones like estrogen and progesterone will be given from outside by the doctor. So it's extremely important that if you're undergoing a HRT FET cycle, you need to follow and comply with the instructions of medicines and timings that are given by your doctor, because there is a particular protocol and the doses of medicines are to be followed timely based on that. So if we are doing a HRT FET cycle, we start like we have discussed. We look at the scan, we look at the blood test, and then we start to give them medicines to mimic the growing egg producing hormones. So initially there will be estrogen injections given, and there will be routine monitoring at fixed intervals, let us say, and we will be looking at how the lining is growing along with this. If there is good lining development, roughly more than 8 millimeters in size, and the vagina, which is very important, is very conducive with less resistance in the blood flow, then we think this is the right time, and that is when we start progesterone hormone. This progesterone hormone can be given either in the form of an oral tablet, vaginal gel, or injections, based upon which patient requires what, that will be started. And if you're doing embryo transfer of a day 3 embryo, once the progesterone is started, day 4 of progesterone is when the embryo transfer happens. If you're doing a day 5 embryo transfer, day 6 of progesterone is when the embryo transfer is done. So once the progesterone has been started and day 6, let us say that day will be the day of embryo transfer. So the actual process remains the same as fresh embryo transfer, wherein the woman is asked to come to the hospital on the day of embryo transfer. It's a daycare procedure. It does not require any admission for a day and night stay, etc. The patient comes in the morning, goes back after a few hours home. There is no anesthesia involved in this process, no pain is there. what is done is we inform the patient that she can eat her food and come to the hospital at a fixed time. On the day of embryo transfer, the embryologist thaws the embryos as per our previous discussion. Whether we are planning a single embryo transfer or a double embryo transfer, that will be communicated to the embryologist and would have been discussed with the patient previously itself. Based on that, that day the embryos are thawed and we wait for them to expand. Once everything looks ready, we would decide that this is the time at which we are planning to do an embryo transfer. And the patient is asked to drink some water and fill her urinary bladder, because this procedure will be done under trans abdominal ultrasound guidance. So, for us to visualize the uterus, we need full bladder, and this also helps us straighten the angle of the cervix and uterus. So, with partially filled bladder, we do the procedure called embryo transfer, wherein these embryos are taken into the embryo transfer catheter, and this catheter is gently introduced into the woman's vagina, cervix, into the uterine cavity, and these are deposited into the uterus as atraumatically as possible. Once this is done, the patient is advised to rest on the table for the next 15 to 20 minutes, after which the patient is shifted back to her room. Following this, she can continue to eat her regular food, drink her food. There is no anesthesia like we discussed, so there are no special requirements for diet that need to be followed. Then, after an hour or two, we are ready to send the patient back home. We will give her final advice as to what are the medications that need to be continued and what are the precautions that she needs to take. It is at this level that multiple patients come with many different questions as to what are the things that are required, what is the care that they need to take in this time. I understand that this 2 weeks following the embryo transfer, we give them a time of 2 weeks, after which we will be doing a test called beta HCG. This beta HCG is what helps us understand whether a lady has successfully conceived following the embryo transfer. So, this beta HCG is nothing but a hormone which is produced by the implanting embryo. It starts to rise from as early as day 8 following an embryo transfer, and we find it in detectable levels around day 14. So, we like to check it at that time. If it comes positive, then we know that it has been a successful embryo transfer. If it is negative, that means the embryos have failed to implant and we do not see an ongoing pregnancy. So, this 2 weeks is what is considered by the patients as the most strenuous period, and I understand and agree this is the level at which stress plays maximum role in everyone's lives, because the weight is what is killing them. So, what needs to be done at this time so that we get the optimal results? First thing first, let's talk about the diet that we advise the patient. The most common question is, what should I eat? What should I not eat? Important thing is that you keep your diet as healthy as possible. Take lots of fresh fruits, vegetables, take plenty of water, and avoid very high fatty diet, processed sugars, cheese, this kind of things. Take complex carbohydrates, take high protein diet. For example, we advise them take one egg a day, these kind of things. Continue to take lot of fruits, vegetables, healthy nuts. These kind of things are going to be beneficial. And what about the foods to be avoided? Generally, nothing significant. We advise them to avoid things like papaya, pineapple. Apart from this, they can continue to take everything else. Next, most importantly asked question is, what about our activity? Do we need to be on bed rest or any other thing we can do to improve our chances of a pregnancy? There is no role of bed rest following an embryo transfer. It is not required. All that is required is that you avoid excessively strenuous activity. For example, if you're somebody who does your office work, who goes to your work, you can continue to go to your work from the next day after your embryo transfer. Do not do heavy lifting or jumping movements, or do not do anything that strains you both physically and mentally. That is the kind of activity that needs to be avoided. To a certain extent, we even advise them to avoid vigorous intimate relations also, because these are going to increase the chances of the uterine contractions. Then, more important than anything else, that more important than diet and activity and everything, is to keep your stress levels low. And how do you do that? For some people, continuing to work is less strenuous. For some people, taking a rest at home might be associated with more stress. So you are a better judge of deciding what gives you less amount of stress. If there is some hobby that you like in the past and for whatever reasons you couldn't pursue it, maybe this is the time to do it. Cultivate a hobby, engage your mind, put yourself in a positive environment, and keep yourself as stress free as is reasonably possible. Take your medications as per the schedule that is given. This is extremely important. We cannot stress more importantly on this, because like we discussed, more so in cases like HRT-FET, wherein the progesterone support and the estrogen support for the ongoing pregnancy is being given from outside. This is extremely important that it is given at timely intervals. So, as per the advised medications time, please continue them. Do not stop any medication on your own. And at the same time, we are seeing a lot of flu season going around, a lot of people getting cold, cough, and fevers, etc. Do not self medicate yourself. Do not start on antibiotics as per your mind or what you have heard from a patient, another friend, or a person, whomever random. Please consult your local doctor, whomever is treating you, take their advice and then take these medications. So the best chances are when we transfer the best possible seed into the soil which is receptive, the soil which is extremely nutritious, has good blood supply, water supply, and these are the chances where we are promoting the best interface between the soil and seed, which when equated to the embryo and endometrium, embryo being the best quality, lining adequately grown with good receptors, good vascular supply, good nutrition. This is when we are promoting the best embryo endometrial interface, thereby improving our chances of a successful crosstalk between the embryo and endometrium. So these are the few instructions that need to be followed on the day of embryo transfer. And following this, eat healthy, limit yourself to less strenuous activity. You can continue to go to work, there is no reason for you to stop working. Avoid strenuous work, be as stress free as possible, continue your medications on time, do not self medicate yourself, stay positive, stay happy, and we all are with you to help you have the best chances possible. If there are any queries, I'm available now. So if there are any queries, you can reach out to us at Apollo Fertility. Thank you.